Good afternoon, and welcome to this edition of HDSA Me, a virtual educational series for the HD community. Today, we welcome Dr. Sharon Sha and Veronica Santini from our HDSA Center of Excellence at Stanford University. They'll be answering your questions on this edition of Ask the Doc. You can send a question at any time during the presentation. Just click on the chat function in the toolbar, type your question, and hit send. This presentation will be available in about a week on HDSA's YouTube channel. On February 4th, Dr. Kristen Rapp will talk about perseveration in HD. You can register for that session by going to HDSA.org/HDSA-ME. And now a little about our speakers. Dr. Sharon Sha is a clinical associate professor of neurology at Stanford University. Her clinical time is devoted to caring for patients with Huntington's disease and other neurodegenerative disorders. Her research is devoted to finding treatments for cognitive disorders. Dr. Veronica Santini joined Stanford in 2014 and has a busy movement disorders and clinical research practice. She oversees a large and dedicated team of specialists providing holistic, patient-centered care. Dr. Santini is passionate about providing equitable healthcare and launching global multidisciplinary neurologic programs to low-income nations. We are delighted to welcome Dr. Santini and Shaw here today, and I'll turn the broadcast over to them now.
Hi, everyone. I really appreciate and feel honored that Dr. Santini and I have been invited to speak and be present here today. Thank you, Deb, for organizing, and everyone else at the HDSA. And I'm, hearing that introduction about Dr. Santini, I'm constantly wowed by her. So I feel really great that she's joining and I'm joining her, and we do this together. I'll begin by starting a little bit by talking about cognition and Huntington's disease. We'll be both be talking about the importance of socialization during this pandemic, and then we'll open it up for questions. Anything else you wanted to say before I started?
I just wanted to echo all the wonderful things that you said. I'm so honored to always be able to work with you, Dr. Shaw, but also to be able to work with the HDSA and partner. We're going to go over just a little bit of what we think is timely in your lives right now, but we don't have to focus questions on that. This is purely an Ask the Doc session for you guys. So whatever's on your mind, type it into the chat box. If we need clarification, we'll ask you to do that. And then we're excited to be able to answer your questions, and hopefully this will be an informative and helpful session for you all.
All right. So as most of you know, Huntington's disease is more than just a motor disease. And we know that there's movement difficulties with chorea. And what we don't often stress is a lot of the cognitive changes and behavioral changes. What we typically see is executive function is impaired. And what is executive function? That usually is the multitasking, working memory, processing speed part of our brain. So we have difficulties with working memory. We have difficulty with planning and multitasking. And as you heard, Deb introduced the next session, there's discussion about perseveration, which makes it hard to be mentally flexible. Some ideas that we always tell our patients are to give yourself extra time to plan and organize and get yourself together. Using memory aids are often helpful too, and avoiding multitasking for all of us can make us more efficient. We want to make sure that we accept help. I know personally, I don't like to ask for help, but I think appreciating that we have a community of support and accepting that support will really take us a long way. The thing that we really wanted to talk about is how isolated we are in this pandemic. I think it's so timely. All of us are feeling the impacts of that, not just COVID itself, but the isolation that this pandemic has brought about. So in doing some research about isolation and well-being, you may already recognize that it is associated with our mental status, that lack of socialization can be associated with depression. And specifically with Alzheimer's disease, when you have increased socialization, there's a lower risk for developing Alzheimer's disease, and high social activity is associated with better late life cognition. If you try to search specifically for socialization in Huntington's disease, it's hard to find good studies, so I'm sort of extrapolating here. But we know that social isolation can lead to anxiety, and contribute to cognitive decline. And because we know there's already cognitive impairment in Huntington's disease, we really want to make sure we enhance that in the ways that we can. In a particular COVID study during this pandemic that was just published in 2020, we saw that there was increased anxiety, depression, poor sleep, and physical inactivity from the social isolation. So we want to make sure that you get the care that you need. This is on you, Dr. Santini.
And certainly that we've heard that from our patients, and our colleagues in neuropsychiatry and psychiatry have also been hearing that from patients pretty universally. The other thing that we know about with this pandemic is that people have avoided getting their regular routine care. And so we want to send the message out to you guys today that it is not okay for you to put off your own health concerns just because there's a pandemic, because your healthcare provider visits are extremely important. And these can be for smaller issues that we don't want to get out of control, or sometimes larger issues that we see that people have been putting off. There's a lot of research, for instance, in stroke, that people just did not go to the hospital when they needed to go. And so don't ignore your health. If you have new or changing symptoms, if you have even non-emergent follow-up care that you need, we would suggest that you go to your neurologist. HDSA Centers of Excellence like Stanford, we've been talking as groups, and what we have found is that we are able to meet patients where they are, whether that's a telephone visit and us sort of making determinations without doing a full physical exam from the comfort of the patient's home. Or we can do video visits and telehealth visits, meeting the patient where they are. They don't have to actually get up off their couch unless we ask them to walk in front of the camera. We are also performing in-person clinic visits, and I think that's quite universal at many of the centers of excellence. And also go to the hospital when is necessary. Don't make it so that we have to convince you to go. Here's a nice little web page reminder of how you can learn more about the Centers of Excellence program. And so we also want to emphasize that you can still make these connections and that self-care is very important. So some of the ways that you can think about still making connections, still keeping your brain active is by listening. For instance, doing some music therapy, playing your favorite music at home. Many people feel, and there's some studies to indicate that classical music certainly helps with our cognitive abilities. And create a soothing playlist. Attend a virtual concert. So there's many orchestras now who are doing virtual concerts since we can't go in person. Listen to a podcast on a subject you enjoy. The Hopes team at Stanford is creating these amazing patient podcasts. And so we would encourage you to go to their websites and check those out. Listen to an audiobook, especially when reading is hard. Many people don't know your local library has audiobooks available for free. And also there's apps, many of them have been made free or at lower cost during the pandemic, that can take you through some guided meditations or mindfulness or breathing exercises. And we highly recommend those. Watch movies, binge watch your favorite TV. You can also go to see artwork by not leaving your couch, but going on an online museum tour. And there's also virtual theater productions or script readings that people have been really enjoying online. So take a look at what's out there. Make an album or collage, reminisce over old photographs that you have, or get some printed from your online library, and do some art therapy. So you could do some guided painting with an online class, or do some independent painting yourself, even if your artwork looks like mine, which is probably at the level of a kindergartner. And to continue with this, there are times where we're going to feel anxious and we're going to feel down, and that's going to affect us. So create some calming spaces within your home. Use some soothing colors. Declutter a certain area that's more soothing. Some essential oils can be very therapeutic, and focusing a little bit on your indoor plant life and flowers. Identify the triggers that are making you feel worse. Is it that you feel cooped up? Are you having pain? Are you having difficulty sleeping? Are you having levels of anxiety? All of these things can be brought up to your healthcare provider to improve your triggers. and then connect with the outdoors. So if you can go outside safely and wear a mask, and use your walking aid, of course, and your wheelchair where necessary, go sit in the park. Or if not, go to your backyard or your front yard or by a window. Listen to the sounds around you. Be mindful. Listen to the birds chirping, the wind blowing. Smell the air. Touch the leaves, touch the grass, the bark on the trees. And if you can't, how about those indoor plants?
Just as you're saying, I know I'm supposed to change the slide, but just saying that makes me feel calmer already.
Yeah.
Thinking about touching the leaves. That's a picture of when I was hiking in Point Lobos, and just hearing the waves or listening to the birds chirping is a good break from also being online all the time too.
Now, you can't do that unless you pay attention to it. So that's the key. Setting
Right.
aside 5 minutes to actually listen to the birds, listen to the wind. And then don't forget to connect with other people. So connect by phone. Many people don't like the video chatting. I know we all get sick of it, but connect by phone. Connect by a video chat if you're okay with that. Do a drive-by visit to a friend, or have your friends or family do drive-by visits to you, where you sit in your front yard or you sit in your driveway and somebody drives by and says hello. Sit in your front yard or your backyard, socially distanced. Talk through a window. And then never forget that there's a number of online support groups, maybe a book club, social groups, exercise classes that you can participate in. It's not the same as being there, but it does create connection. And then finally, I think people sometimes don't tap into their local community resources as much as they could. So we mentioned the local library, but often your town might have a local newsletter of things that are going on virtually. There's this app called Nextdoor. There's probably others out there as well, where you can kind of tap into the businesses around you and the activities going on around you in your very specific neighborhood. And then last but not least, of course, let's not forget the incredible resources at the HDSA. So they have actually a whole page in this red here, this website in red, devoted to COVID-19 pandemic resources. They have also the HDSA support groups, all virtual right now, many of them, and for many different types of people, caregivers, people suffering from disease, youth support. We have our youth organizations down on the bottom left of the screen, lots of information about telehealth on the bottom right of the screen, and the HOPES project, which we mentioned again out of Stanford University, which really does a lot of outreach and education on research and other things going on, the latest things going on in Huntington's disease. Don't forget that research is still going on despite the pandemic. There was a little lull at some institutions, but now things are really picking up again. And so your local centers are here for you. And I think with that, we'll just open it up to any of the questions. I think a lot are coming in with the chat, so we'll take a look right now.
Let's see what we have. Thanks for all that. I will say that, you know, the HOPES, just if people who don't know, the HOPES is a group of undergraduates at Stanford that want to disseminate education. So I was able to listen to a podcast that they had created. It was really moving, a story about a couple and what they went through in terms of having a baby. So just thinking about hearing outside yourself or hearing a story might be a way to connect too. Should we get to a question?
Let's do it. Should we start from the top?
Sure.
To be fair.
Mm-hmm.
Dr. Shaw, I'll let you take this one. Wave Science has announced plans to provide an update regarding their research initiative. Are you familiar with the initiative, and could you comment on it?
Yeah, I think, you know, what we may have heard about in terms of clinical trials. So just to clarify, research is trying to understand a question, and clinical trials are research that are specifically trying to understand whether a drug might work for a disease. And so in clinical trials, there are different stages. Usually when they just invent a drug, they want to see if it's safe in humans after they try it in animals. Then they want to test it in the patient population, and they want to see if it works. And so the drugs that are really have been exciting were targeting the protein, the Huntington protein. We know that Huntington's disease is a genetic disease, which affects the protein. And so Genentech, Roche, and Wave Science have created what we call antisense oligonucleotides. Let's call them ASOs for short. So these ASOs target that protein. And so we think hopefully maybe that'll help reduce the symptoms or reduce the disease progression. It's all very early stages though, so it's hard to say whether it works as of yet. Wave Science, what I've seen so far is that they said, hey, we were able to reduce this percentage, maybe 12% of the Huntington protein. Is that enough to change the disease? We just don't know. So it's still in the clinical trial. We need to hear more about the data. And usually when it's a phase 2 trial, that means that just trying to see how it works in this patient population. We need the phase 3 trial where we get a lot of people to see if it works. So both the Roche and the Wave Science is very exciting. I think, you know, a decade ago, we couldn't have even thought of ASOs. So it's super exciting, but it's still too early to say whether it works, and too much comments as of yet. All right, thanks for that question. I'll read the next one and we'll target it to you, Dr.
Yeah, I think I can handle that one.
So someone says, I drool all day, I grind my teeth, my brain feels empty.
Okay. So, you know, this is a common problem. And, you know, just so you understand, it's not just a common problem in Huntington's disease, but it's a common problem in many of our neurodegenerative disorders. So the drooling can happen for a variety of reasons. And the grinding of the teeth is something that we call bruxism. And it certainly can worsen with stress. And it can happen in the absence of neurodegenerative disease. In fact, both of these symptoms can. One therapy that we think is super effective actually for both of these conditions is botulinum toxin injection. So you may know it by the brand name Botox. It's sort of the Kleenex of botulinum toxins. And we know that people are using it for wrinkles and all kinds of other things. But what it does for drooling is it dries up the salivary glands and allows people to not have so much saliva so that they can manage it better and swallow the smaller amounts of saliva that they do have. The botulinum toxin works really well, not only on salivary glands, but the reason it works well on wrinkles is because it relaxes muscles. So the muscles that control grinding of the teeth, you can feel them right here. They're called the masseter muscles, big muscles. There's also these other muscles up here called temporalis. And what we can do is we can target every 3 months injections of the botulinum toxin to relax the muscles. And this actually gives people quite a bit of relief. And it's great because then you don't have to take another medication every day by mouth. Certainly there are some medications, but the botulinum toxins just work fantastic for that. Dr. Sha, because let's face it, you are the expert on cognition, being a behavioral neurologist, I'm going to punt this question back to you.
Sure.
Brain feeling empty.
Yeah, and I think just for you guys on the webinar who may not know, Dr. Santini and I were great sort of partners because she's movement trained and I'm cognitively trained, meaning like I studied like the memory and that sort of thing. And so that's why we're sort of punting a little bit. And so I learned a lot, you know, besides Botox for looking good, you know, how helpful is it for bruxism? So brain feeling empty, it's hard, you know, this is a really hard answer and sort of how do we treat this? You know, there are some small clinical trials in looking at certain types of medications that we use in Alzheimer's disease to help attention and concentration. What I said earlier in Huntington's disease is that we have problems with our working memory, our multitasking, and all of that. And what can feed into that is worsening anxiety, depression, worries, all of that. So we want to sort of break that cycle. So doing all the measures that we talked about by exercising, connecting with people might help. A medication might help, but feeling empty, it's hard to diagnose. Is that because of the cognition? Is it because of mood? And it might be all of that, you know, and it might be feeling like you can't concentrate and getting a grasp on things. So thank you for sharing that. And I think there are a few different things, whether it's behavioral techniques or even medications that might help you feel a little bit better too. Should I read this next one?
Yeah, so oh, yeah. No, yeah, I think it's great. So, you know, I've read this one, and so I can give you a little summary and maybe I can respond to this. In this circumstance, I wanted to very much thank this caregiver for being so candid and offering such a candid question. We're being asked here that this person is asking us about their ex-husband with a family history of Huntington's disease, and sort of that they've been on the lookout for any possible symptoms of the disease throughout the years, and maybe that this person might be manifesting some symptoms of the disease right now. So maybe that there's a little bit of thinking issue, and maybe there are some physical declines as well. But the question is, do you confront somebody that you know well, that you feel very close to, about these potential symptoms that you see arising? Or do you allow the person to sort of live in blissful ignorance or sort of denial, because they might not be noticing the same symptoms that you're noticing objectively? And what I would say is that, we see this a lot. So the question is does somebody else see symptoms that you don't necessarily see? And this comes up a lot in people who have cognitive decline or thinking decline, and even people who have physical abilities that are getting more difficult to handle. And so this question always comes up. Do you want to, bring it in their face and let them know that they have a disease, or do you let them sort of live in the way that they're feeling? One resource that I really want to emphasize here is that a care team, like a Center of Excellence doctor or a Huntington's doctor, can start to partner with patients before even diagnosing them, before testing them, before diagnosing them, and understand that it's a partnership that you create with that doctor. You can go there and you can say, hey, I just want to know about Huntington's disease. I don't want to get tested. My family has it. I don't want you to examine me. And we would respect that 100%, just to give you more information and let you understand that, hey, if something comes up in the future, we're here for support. So I actually think that that becomes a big portion of the care. Now, the question is, do you push somebody to go and get evaluated? And if there's no treatment right now, and I agree, right now we don't have any treatment that changes the disease course, but what Dr. Shah was just talking about with the ASOs and other treatments that are currently in clinical trials and under development is that we may be able to do that very shortly. We still don't have the data. We are hopeful, but we can't say that that's going to be a for sure. But I do very strongly believe that in the next number of years, one of the things that is being trialed is going to be beneficial. And then I would say it's absolutely a great idea to think about getting early interventions and treatment. Dr. Shah, what do you think?
Yeah, I think it's a very difficult situation because it's an ex also. What is the relationship like, and it may not be denial, might be a lack of insight or recognition, as we have said, and she recognizes, so if it's not her, but she has concerns, I wonder if there are other close family and friends that she could reach out to suggest just establishing care. Because even if there isn't an intervention that will change the course of his disease, establishing care so that we can plan for the future in case things change. So like a Center of Excellence where there's physical therapy, where there are neuropsychiatrists, where there's social workers, where that you can kind of think about if things might change, we're ready for it. We're not scrambling for picking up some pieces that might be harder. I believe they share a 12-year-old son. So thinking about all of those things, I think would be helpful. So I wouldn't push her specifically, but I'd encourage her to talk to people to see if there are ways to have him seek out care and what his concerns are. If he doesn't want to know, but maybe thinking about his son or something like that to get support would be great.
Yeah, and I think that's the other element to it. We have a support team in place, right? And so Dr. Shah and I have both met with people who are at risk, and they may or may not be interested in testing, but they'll come to us and they'll say, I know I have the disease. And really what they're describing to us is natural for many people in their age group, or, just people day to day. And so I think having that support, people who understand the disease, people who understand how it is to have a family member who had the disease, I think can in and of itself be quite therapeutic. All right,
So
Dr. Shah?
Then is anesthesia contraindicated in Huntington's disease? I heard about a person with Huntington's disease who woke up during surgery. My husband is having minor surgery, and I'm wondering what I should tell the anesthesiologist. I can take a little bit, and if you want to add, Dr. Santini, I think, so I'll say that my husband is an anesthesiologist, and if he heard that someone woke up during surgery, he'll say, are you sure? You know, because they work very hard not to. So, and to be honest, you know, I don't think that there isn't a contraindication for Huntington's disease. Like if you need surgery, you need surgery. I think there is a conversation that you have with the anesthesiologist to let them know. Anesthesiologists want to know about all your medical conditions because that might play a role in the medications they use for the surgery. And if you're worried about, say, cognition, so your memory, you might want to make sure you tell the anesthesiologist so they can say, well, is there a way to avoid general anesthesia? I think we want to avoid general anesthesia in general because there can be brain side effects. We just don't know. There isn't enough studies. But if it could, say it's a minor surgery on a hand, maybe you can do local or a nerve block or something like that. So having that conversation. Also, if your husband is taking medications already for mood or otherwise, like benzodiazepines or other things like that, that will play a role in the medications that they choose during the surgery. So I think it's helpful to have the discussion, but I would not say it's black and white contraindicated, no.
No, and the other thing I would add to that is that sometimes we need the general anesthesia or the anesthesia in general to calm down movement. So there are certain procedures where the movements are too robust or too much involuntary movement. We might need the anesthesia to calm down the movements. Now, that's also a discussion because you can talk with your neurologist about maybe using oral medications. Can we up the meds for a period of time so you can get this procedure without the general anesthesia? So definitely not a contraindication, but there are some nuances for any individual given person. And I think being really forthcoming with your neurologist and also with the anesthesiologist would be very helpful. So we've got another one here that says, I've been using telehealth for the last several months for care. How do you prepare to go back to the clinic? How do I prepare to go back to the clinic? So should I keep going?
Sure. Yeah.
So what I would say is prepare like you would for a normal clinic visit. Make sure you have your med list. Make sure you have a list of things you want to talk with to the doctor. You know what the general way back is going to look like. You're going to sit with the doctor, you're going to talk to them, and you're going to have an evaluation. What I'd say is when we have patients coming back to the clinic, which we do, I was just seeing patients, Dr. Shah was just seeing patients this morning, we do it in a very safe way. So the clinic, like every other place now in society, has designated areas where you can stand, where you can sit. You're supposed to be socially distanced. Everyone has to wear a mask. And in fact, when you walk into our building, we ensure that you have a new mask, a surgical mask, and everybody's wearing that. In addition, we'll ask you a series of questions. Have you had any of these symptoms in the last X period of days? And if so, we can always give advice that we don't think you should have, you should necessarily come back to the clinic, etc. Your doctor will be very cognizant about hand washing, wearing gloves, keeping some distance within the room itself. They may forego a couple of the things on examination if they don't feel like it's necessary and they don't want to put you at risk. If you need to take your mask down, it'll be for a brief moment, and then we'll have you put your mask back on. So as you can tell by what I'm saying, there's a lot of safety measures put in place to ensure your safety when you do come back to clinics.
The other thing I'd mention is that if you need someone with you to come to the appointment, like a caregiver or partner or something, you can ask the clinic ahead of time. Our Stanford Neuroscience building allows one person to join you, but you want to make sure that wherever you're getting care, that they are aware of that, they allow that, so you can get the support that you need. Okay, so as a caregiver, how can I carve out time for myself? That's so hard. It's so important. You know, I think that it's just, I'll just start talking if that's okay. I think it's just so hard. You know, I think it's important that you're asking this question. I really thank you for asking this question because, of course, a lot of times we focus on the patient, but the caregiver, loved one, whoever is really involved, it's a family that we're taking care of, not just a patient, you know? And I always say this, if you can't take care of yourself, you can't take care of someone else. So, you know, in the pandemic, it's really hard. We don't have our normal resources for, say, adult day programs or hiring extra caregivers, you know. So it's little pieces. If you can work on your support network, are there people in your lives, whether they're family or friends, that you feel that are part of your bubble, or even a distant sort of support so that you can have time for yourself? And if there isn't that possibility, building into your routine, you know, if I'm getting up a little bit earlier or staying up a little bit later, I know sleep is important, but taking that extra time, whether it's 20 minutes or 30 minutes, to meditate, to exercise, to do some deep breathing, to listen to the birds that we talked about, you know, so you do build that into your daily routine, that would be super helpful. It's hard. It's super, super hard. But if you can
and
do
in
that.
addition, again, asking for help, right? Just like Dr. Sha is saying, find who's in your support network and see if you can get an hour reprieve or 2 hours in a week. I've had caregivers tell me very, very simple things, that they want to feel safe going to the grocery store without worrying the whole time. So even if that's what it is that gives you a little sense of relief, alone time to get that one chore done, I would highly advise exercise and using that if that's your kind of break. But find who can be helpful to you to provide that one break, even if it's hiring a caregiver for that 1 or 2 hours a week, even if you think you got it covered otherwise. And then please listen to your neurologist. We are often advising it. Our patients often say, I don't want any caregiving. I don't want anyone else but my spouse or my child or whoever it is to help me. And sometimes that's unreasonable. And so sometimes, even if we don't want it, let's ask for help.
I mean, I can't comment on this enough. You know, I think it's so important that if you can hire someone, I know people get really nervous in the pandemic about hiring help. But if there's a way that you feel safe, a lot of these care resources, they're very, I think, conscientious of making sure those people that you hire are vetted and know safe practices and things like that. So I think it's potentially worth it if you can feel comfortable that way. Okay.
So next question is from Bonnie. Hi, Bonnie. I wish I could see you. Always great to take care of your family when I could. We wanted an update on the Ionis Roche trial. Unfortunately, I don't think we have a lot of data updates. We are no longer enrolling in the trial. So now it's a matter of being able to analyze the data once the trial is completed. So we do suspect that that's going to take a bit of time, but that's sort of what Dr. Sha was talking about earlier with the ASO trials. But you got it. That's exactly right. The antisense oligonucleotides. We're hopeful.
Idea.
Dr. Sha.
Yeah, ideas for help with perseveration. That's tough. I think there's a whole webinar on that next in the next session. You know, it's tough because it's part of the brain having difficulty, you know. So I don't think there's a quick fix here. There isn't a medication that I could say, oh, take that, you're done, you know. And it's sort of the brain is having difficulty switching from one item that you're sort of doing and then changing topics. So if there's a way to focus and then remind yourself, or setting reminders to switch, you know, we always recommend not doing multitasking, you know, but if you're too focused on something, you can't change. So setting reminders, those behavioral techniques, maybe alarms and things like that could be helpful. And I think thinking about the situation, it's hard and sort of in broad strokes. In which situation is the perseveration difficult? Is it something compulsive that you're doing, or something else in terms of thinking or planning? So again, asking for help, and then maybe talking to your doctor too about in which ways this perseveration is making it difficult for you.
Yeah, I think finding reminders that take some of the burden off the caregiver. So a constant paper that's got a nice big, this is the day of the week, this is the time of day, right? That the patient can refer to themselves. And then oftentimes things that are out of a routine may cause some increase in that perseveration or anxiety. So finding triggers of how to reduce it. So what is it? Is it anxiety that's causing more perseveration? But it's certainly a challenge. All right.
Helping people with HD with sleep.
Oh gosh, so many. So here's the deal with sleep. Sleep can be interrupted in so many of our neurodegenerative diseases, including HD, for a variety of reasons. Number one, motor symptoms interfere with sleep. So it's very important that you're identifying, the neurologist is identifying, could this be a component of the sleep difficulty? Is there a difficulty with anxiety or mood disorder? Incredibly common that one of the physical symptoms of mood disorder, anxiety, or depression is a change in the sleep pattern, difficulty falling asleep, waking up early, things like that. Are there other things that are physically interfering with sleep? Is there pain? Is there too much urination? There are lots of conservative things that you can do once you identify what the trigger is, and there are medication changes that you can make. Let's say you don't want to take medicines normally for your motor symptoms. Well, it might be important to get you some good sleep at night, and so you might just target medications just at nighttime. One of the best things people can do is start to calm their brain down when it's time to sleep. So what does that mean? It means staying awake during the daytime, getting sunshine, and being active during the day. That combats sleepiness during the day. And then as the evening, and that includes exercise for those of you who are trying to get out of that component. And then the addition is at night, it's time to start to rest the brain. We're going to lower the lights. We're getting rid of screens. No more Zoom, no more tablets, no more phones. You're going to have to go back to the good old days where we used to read paper books, okay? And getting the body to relax, quiet environment, etc. So getting back to those basics of routine make a big, big difference in sleep.
I'm glad you mentioned the screens. I got these new glasses. I hope you like them. They have blue light protection in the glasses. So, you know, and I have a real book. It's like this heavy or this wide. So I think that's really helpful. Those sleep hygiene techniques and behavioral techniques can be super helpful. And I think this segues into the next question about exercise. So what types of complementary and alternative medicine strategies have you found most helpful for your patients with HD? I can't stress enough, and I didn't use my virtual background that I was going to use with with the ocean in the background. But really, I believe in exercise, and I wouldn't call that complementary or alternative medicine, but I really think that it's so important for our mental health, our cognitive health, our physical health, that it's beyond a lot of what medicines are available to. So because it has so many beneficial effects, I think we really need to make sure that we're getting that outside time, the nature time. One of my colleagues did research in older adults, cognitively normal, who went on nature walks. And when they were on nature walks taking pictures of awe-inspiring scenes, they actually had more genuine smiles when they were focusing on the nature as opposed to themselves. So I think that this can
So there's a term for that, which we call forest bathing, but you don't have to be in a forest. You can be anywhere. And again, that's really important. Go ahead.
So, oh, sorry, I'm just being redundant, that I think that that's so much more important than, say, certain medicines even. So, but I'll let you.
Identifying those other additional factors that could be disturbing sleep. So rather than being resistant to a mood drug, maybe that's going to be the thing that actually can help you get that better sleep. You know, in regard to sleep, we've got another question. What about the opposite? When the person is up all day and, sleeps all day and up all night? Really a very common problem in Huntington's disease. And we know that the circadian rhythm is likely affected in brainstem disorders pretty significantly. So what I would say to that is that it's going to be really important to start to restructure and reverse the sleep-wake cycle as best we can. Now that takes a lot. It takes a lot of motivation, and usually people have to go through a very difficult period to reverse it completely. So that means being strict, no naps. And how do we prevent from napping means we have to be active as much as possible. I would recommend getting sunlight in the early morning and towards the late afternoon, twice a day, and good doses of sunlight. We have plenty of sunlight in California, but if you happen to be in an area where you can't get any, you don't have an outdoor space to sit in to get that direct sunlight, what you can do is buy a 10,000 lux light box and sit under that for a good 30 minutes or so, particularly when someone's getting tired. Now, if you can't not nap at all, limit it. 30 minutes, no more, absolutely. And then the person needs to wake up. It's going to be a rough transition, but these things have to happen to really exhaust the body so one can sleep at night.
And I was going to say, if you are feeling sleepy, try to exercise. Go for a walk or a recumbent bicycle, because you can't fall asleep while you're exercising. It's pretty hard to do so. So trying to do that to prevent it, and then the exercise will be good for your body and help tire you out so you can sleep better too.
And Roy's giving us a great example here, Roy. Saying also, how about the melatonin? Yes. So towards the evening, when it is actually time to do those calming things to go to sleep, using things like melatonin, which are natural supplements in our mind that help our body to relax and get ready for sleep. So absolutely.
So I think there are people thanking you, and then what about vaccination? I think we talked about
hot topic
before here. Yeah. So should the person with HD and the caregiver get vaccinated at the same time? Oh, that's a good question. I didn't anticipate that question. And what do I need to know? What should I ask my doctor? Do you want
Such
me
a great question.
Yeah.
You can feel welcome.
I think this is a very well thought out question, because I thought the questions were going to be, should I get vaccinated? And I think
me too.
So just like we know about what's published about the vaccines, there are multiple vaccines that are approved and some that might be approved soon. The problem is, how do we apply this directly to you with Huntington's disease, or you with Huntington's disease plus other medical conditions, or you as a care partner? And so it's hard to say, okay, this will apply directly to you, because they didn't include people with Huntington's disease. And we can't say, of the 2,000 people that had Huntington's disease, this is the benefit for this particular vaccine. So it's hard to extrapolate. But I think what we need to think about is the risk, the risk of developing COVID and some of the comorbidities, meaning other medical problems. So if you have high blood pressure, if you have sickle cell disease, if you're older than 65, all of these things that are making you at greater risk for being even sicker if you develop COVID, then that risk might outweigh, staying away from the vaccine. That maybe the benefit of getting the vaccine and the protection and even the socialization that might come with getting vaccinated might be more important. So I think asking the doctor about what your medical conditions, having a good discussion about what all the medical conditions are that you have and the risk benefit profile. I think the thing about getting vaccinated at the same time, although convenient, is that if there are side effects, making sure that you have some support in case you need help. So the side effects that are common, usually with a second dose, are more of a mild flu-like syndrome. So meaning like muscle aches, headache, fatigue, maybe a mild fever. And if you're both having it at the same time, if you really need help taking care of the person with HD, then maybe we don't want to take it at the same time. You have extra help or something like that, or you stagger it.
I would stagger it by, I would probably advise that you stagger these things by at least a week. We know that COVID vaccine reactions are going to dissipate within 48 or no more than 72 hours, according to what we know right now. And again, usually with the second dose. So you might as well stagger it by a week just to be safe, unless you've got extra support of people who can help you. All right, after all these months in isolation, how can I tell what exercise is now appropriate? I think you might know the answer about what I'm going to say. And part of that is utilizing our experts. So number one, you don't want to go all out, and not, if you haven't moved, now you're going to go to Yosemite and you're going to climb, you know, your Half Dome, right? That doesn't make much sense. You want to get gently back into exercise, and that might mean different things for different people. So it may mean limiting to a specific type of exercise, or it may mean going to a specific time limit or number of times per week. Those are all ways in which you can slowly build up the exercise. But to know really truly what is best for you, let's utilize our experts. Let's go to physical therapy. Nobody likes it, and yet it's so helpful. So let's partner with our physical therapy experts. Let's take a look at what the HDSA recommends, any webinars available to us for exercise. But ultimately, if you want to have that really kind of tailored regimen for yourself, I think physical therapy is a great way to get started. And I think people forget to ask their physical therapist, how do I kind of accelerate the exercise? How do I build it up? Are you going to push me to do that? And I think that can be really, really helpful. I know in our clinic, in our clinic, we have that as part of our multidisciplinary clinics. Many centers of excellence have the same, but your general neurologist would also have access to a good physical therapist.
Yeah, I like starting slow. You know, I have a recumbent bicycle. I think I recommend those for a lot of patients because of the decreased risk for falls, and you can adjust the resistance, and you can start off with, you know, 5 minutes, 10 minutes, you know, or whatever, while you're watching TV, you know, whichever, while you're reading that book. So starting off slow and then building up, but I think PT would be helpful. Someone's asking, should we be asking for PT evaluations, swallowing evaluations? And that would be, I would say, yes, you know, ask your doctor, should I get that? You know, and it might be a good reminder if they haven't already thought about it. I would hope that all of us in our Center of Excellence have a lot of these resources and are thinking about it and build it in. But if you're seeing a community neurologist or even your primary care doctor, they can ask you about it. A lot of times we ask our patients regularly, are there swallowing difficulties? So that might prompt us to do the swallow evaluation if there's a yes to that. And we typically ask about balance difficulty and falls, and that might prompt us to get physical therapy evaluations or referrals. So definitely.
Let me ask you this, Dr. Sha, has there ever been a circumstance where a patient has asked you if you should get physical therapy and you've said no? It's rare, right? There might be,
if they're asking about it, then I'm say, yes, let's do it. You know, it's like, should I exercise? Yes, do it.
Yeah.
You know?
So it's a great reminder. For the swallow evaluations, it might also prompt your physician to ask a few more questions about what your risks are, because there's a lot to cover in any given healthcare visit. And so maybe that'll give a nice prompt.
Mm-hmm.
You know, we've had a number of things being suggested here for sleep, which is awesome. Some reiteration. I'm going to look back here and see if we've missed any other questions. I know we might be going a little over time, but we don't mind because that's what we're here. We're here to help.
What time are we supposed to end?
I don't know. I don't know the answer to that.
We have another 11 minutes.
Oh, beautiful. Oh, I'm just always used to being behind that, I thought. Let's see, what other questions might be on people's minds?
Are you asking me?
I'm sort of rhetorically asking and also thinking about it.
So now's your time. If you've been afraid to type something in the chat box, now's your time to enter it.
Yeah, good questions here. This is a great question. What about muttering? And I'm assuming this means sort of muttering and talking to oneself, or does that mean low speech volume? We could maybe talk about both. I'll start off with the low speech volume. Clearly, I do not have that problem, and I apologize to everybody who has
talking to himself.
Okay, talking to himself. Okay. It's a good question.
Yeah, I mean, I think, let me just take a stab at, if he's talking to himself, is that because he's trying to remind himself, for if I'm alone too long, I'm talking to myself, or if I'm trying to keep something in my memory, not to forget it, I am going to repeat it over and over. Like, remember when you used to have actual telephones and I would repeat the number over and over before I'm typing it in. But talking to oneself could also mean what we call psychosis, that there might be a hallucination or some internal stimuli, or what he thinks is an external stimuli, and talking that way. So I think trying to get a little bit of an understanding of what is going on behind that might help the doctor give you guidance on what to do. So if there is a psychosis or talking to internal stimuli, is there medication for that? There is, but is it worth it? Is it bothering him? Is it causing him anxiety, versus something else where it's a behavioral technique? So I think it depends on how bothersome it is to you and him, and what, whether medication might be important there. Any other comments that you had, Veronica?
I think the only other comment that I would make about the muttering is that it may also be very nerve-wracking for a caregiver. I've had several caregivers talk to me about how they just can't stand the muttering all the time. It might be very repetitive. But sometimes taking a step back and recognizing if it's not bothering either the patient or too much the caregiver, it might not be so harmful. I think these types of things get very harmful when people are sort of like stuck in their own world, if there's a psychosis part to it, or if it's causing a behavior change. But if it's not, it might be something to just get more education on, and maybe not treat with a medication or treat with an intervention of some sort, if that makes sense.
She says, thanks, they'll talk to her doctor. And what about DBS and HD?
Oh yeah, so the issue with DBS and HD is that
that's deep brain stimulation for people.
Deep brain stimulation in Huntington's disease. So what we know about deep brain stimulation in Huntington's disease, it's been typically targeted in an area of the brain called the globus pallidus interna. And the information that we have about it is that it is, we have very small amounts of data. So the trials that have been done in deep brain stimulation in Huntington's disease have either been what we call case reports, so it's been done in one person, or there's these very small case series, so 7 people, 10 people, something like that. So there's not a huge amount, there are not large trials of deep brain stimulation in Huntington's disease. When we're thinking about what it can help with, it's important to remember that Huntington's disease is that trifecta of the cognitive symptoms, the psychiatric symptoms, and also the motor symptoms. So when we're talking about deep brain stimulation in Huntington's disease, what we're talking about is the motor symptoms in particular. They tend to be the ones that can be most effective for what we say like medication refractory chorea. So the involuntary movements perhaps that are not being well treated with medications. There are risks when it comes to doing deep brain stimulation, and those risks can include worsening of cognitive and psychiatric symptoms. So what I'd say is we have inadequate amounts of data for the treatment with deep brain stimulation, and there are risks that need to be thoroughly discussed and evaluated before you would even consider this type of treatment in Huntington's disease. And it would need to be really focused on a goal of treating motor symptoms that you can't treat with medications.
So this next question is about children. It's a really good question. Do you have suggestions on who is best to counsel a child and how to cope with having a parent with Huntington's? A child psychologist, someone that specializes in Huntington's disease? Is there a better age to discuss this? This could be particularly tough for a preteen who probably doesn't have the cognitive sophistication to deal with this yet. I'll definitely wait until dad has a positive diagnosis, but what if she starts asking about why dad's head jerks, etc. I'll take an initial sort of impression, and then Dr. Santini, you can add a little bit. I think that's really difficult. And then depending on the age of the child, I'm always trying to be honest and sharing, so I think it's important, if there is a diagnosis, once you have a diagnosis, to talk about age appropriate disease specifics. So, if we know that there's a diagnosis of Huntington's disease, oh, that's part of his disease, don't worry about that, doesn't hurt him, versus someone who's older who might be able to understand that there are other ramifications of it. And maybe that's why dad can't play with you right now, or that sort of thing too. If there's access to a child psychologist, that's fantastic. If you wanted to talk to a Huntington specialist, I don't think they're mutually exclusive. You'd want to talk to a pediatric Huntington specialist, though I will say that a lot of our HDSA Centers of Excellence and those who know HD, we have genetic counselors and we deal with families a lot, So I think it'd be great to have that discussion, but if you can have access to a child psychologist or a pediatric neurologist who specializes in HD, they can talk to the child a little bit more directly, and it really depends on the age, as I said earlier, about what their ability to understand, comprehend, and knowing your child too. So not just the age, okay, 12-year-olds, they must understand this, but knowing the maturity of the child and what they might want to know, what they are interested in. I know my son, who's 9, almost 10, asks a lot of questions. So I can't just get away with, oh, that's just dad, I'd have to go a lot further. Whereas my daughter, who's 6.5, might have a lot more worries and concerns. So I might be a little more restrictive there.
Yeah, I think one underutilized aspect is, again, to recognize that you can actually have this discussion, and it's going to be very dependent on the child and what you think is best for the child, but you can have this discussion actually in the clinic. So sometimes what we do is we bring the family in and we kind of allow for we devote a whole clinic visit to a family discussion where we can discuss, hey, what, you might have noticed that dad's head jerks. And have you ever thought about that? Yeah, I have. And, and what does that mean? And the other thing is that oftentimes we can partner with our pediatric movement disorder specialists, and they are often very well versed in the availability of lots of different services for kids that we don't necessarily have in the adult world. So I think that can be super helpful. The other thing that I would recommend is that you do tap into the HDSA youth organization. So the National Youth Organization and
Yeah, I was going to say that also, that the HDSA and their, I think, support groups and their programs and even camps when we were in person supporting kids with HD or kids who have families with HD too. So I think that's important to make sure.
The National Youth Alliance, yeah.
Yeah, and Deb is also saying that HDSA has some resources on talking with kids about HD. Here's the Deal web series, did a webinar on that. So looking at the HDSA website can be helpful, but there are definitely support groups too.
Yeah. And
I think that's, I don't think there are more questions, and we have 1 minute left, unless you see another question.
I don't see another question. We have been really honored to spend this time with you. We are always happy to come back and do another session like this, but I know that the HDSA actually has a ton of webinars coming up, and we're going to continue to make sure that we provide you guys with the information that you need. Any final thoughts, Deb?
I do want to thank both of you. This has been a fantastic session. Had a wide variety of questions. I hope that everyone had an opportunity to, ask what they wanted to ask. If not, they're welcome to send questions to me, and I'll be happy to forward them on to both of you. I'm glad that you volunteered again. I always do like volunteers, and I'll find something else for you to do shortly. Don't worry. But in the interim, I do want to thank everybody for taking time out of their busy day to join us for this session of Ask the Doc. And just a reminder that on February 4th, Dr. Kristen Rapp will be talking about perseveration. So again, thank you, Dr. Santini and Shaw, for taking the time from your day to do this session, and have a pleasant one.
Thank you so much.
Bye-bye.
Bye.
Bye.